Hi, my name is Jean-Sebastien Claveau. I'm a hematologist at Hôpital Maisonneuve-Rosemont in Montreal, Canada. I did my fellowship at Mayo Clinic in Minnesota. So today I will talk about progressions in multiple myeloma. Currently, with the criteria that we use when a patient relates from his myeloma, we need to do two blood or urinary assessment at two different times to confirm that the patient is really progressing from his disease. If it's the case, we need to change the treatment. Usually we do the first assessment, and if it's meeting the progressions criteria, we will be doing few days after or few weeks after a second assessment, and we will change the treatment. In our study, we look at close to 600 patients at Mayo Clinic that were enrolled in research protocol, and we look at the time when they have the progressions. And what we see is that on some patients, or close to 70% of patients, we can see that one test is telling us that they are progressing at one moment at the time. But if we look at a second test, we are also able to say that at that time point that the patient is progressing with two tests at the same time. It's useful for us because we don't need to do a second test to confirm the progressions. Especially useful is, for example, a patient is rapidly progressing and we need to change treatment. So on that time, we don't need to wait a week or even a month in some case before changing the treatment. We can go faster and change the treatment. It was also doing some issue in some clinical trial or research protocol where the patient did not have the second assessment before changing the treatment. So now at that time, when it's possible, when we can use these simultaneous criteria, it will avoid to do a second blood test or a second urinary test, and it will also avoid to the patients to come a second time at the hospital just to confirm that his disease is really progressing. So it's not working there is some limitations. It's not working on every patient, but on some select case, it can be something interesting. And we hope that will be add to the revisions of the response criteria that the International Myeloma Working Group will update in the next few months or next few years. So the goal is to eliminate time toxicities related to the disease, relate to also treatment that takes time before we are able to change the treatment. And it can also help to enroll some patients in clinical research, because in research we have a time to screen or to do that everything is good before changing the treatment or starting the new research treatment. So if we can do that timeline between the time that we say that the patient is relapsing and the start of the new treatment, if it's shorter, it can be better for the patients, and especially to avoid some complications, some bone complications, some renal complications, and also anemia. So it can be really good for patients. It's always difficult for patients or even for the physicians to know when is the best timing to change the treatment. I think that this new criteria or new way to work with patients relapsing can be something interesting for some patients, and we hope that it will be used by clinicians in the next few years.